good day to the Honorable Senators Lamar, Murray, and the rest of the Senate Health, Education, Labor, and Pensions Committee, to FDA Director Janet Woodcock and the other FDA directors involved in reviewing GM604. My name is Joshua Laff. I am appealing to you to support and or approve Donovan's request that GM604 be advanced to the FDA's Accelerated Approval Program. I and people like me need your help now. In April of 2014, I was diagnosed with ALS, amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. ALS is a neuromuscular disease that affects the nerve cells for voluntary muscles. I have what's referred to as bulbar onset ALS. This means my face region is primarily affected first. I am 42 years old. A year prior to my diagnosis, I started experiencing subtle slurring in my speech. I record this message in just under 2 years' time from the first unignorable symptom. I used to be able to sing rather well. Today I can barely speak. Looking back in time, muscle cramps, fatigue, and occasional choking when drinking water over the past 10 years could all have been early symptoms of ALS that one might not think twice about. Now I chew ice to stay hydrated because I usually choke when drinking any quantity of water. I cannot eat foods such as steak or sushi because my tongue is too weak to assist in chewing. Most days I have scrambled eggs for breakfast and rice with ground beef for dinner. I repeatedly bite the insides of my cheeks when chewing. I regularly do not get a good night's sleep as I wake up multiple times throughout the night drooling. Fortunately, my drooling during waking hours is minimal, usually towards the end of my meals. My arms and legs still work fairly well. I am mobile without much difficulty, and I can drive safely both a car and a transit bus for my job. Strength in the tips of my fingers is almost non-existent. Activities such as buttoning a shirt or using toilet paper in the bathroom are exceptionally difficult for me. Turning a combination lock or the keys in my car's ignition is a challenge. I tend to use my whole hand when needing to grab items such as these, but I am still prone to dropping things. Even chopping and dicing an onion is a struggle. I am aware that my breathing is becoming problematic. I must be especially vigilant against becoming sick. Pneumonia is one of the significant causes of death among people with ALS, or PALS as referred to in the ALS community. Currently, there is virtually no FDA approved treatment for ALS. One drug, Riluzole, has been demonstrated to extend the life of PALS by a few months. This is the only recognized treatment available. Jennifer has recently been meeting with the FDA to pursue accelerated approval of their drug GM604. The drug performed well in a recent phase 2A trial and appeared to be safe. I have a strong background in science and mathematics. I recognize the importance of proper studies to determine the safety and efficacy of new medication. I understand the correlation between sample size and statistical significance, and I am aware of the relatively small size in GM604's 2A trial. I believe in the case of ALS and GM604, the need of accelerated approval outweighs the risk. With regards to safety, ALS patients have a very poor prognosis. Most die within 2 to 5 years from time of diagnosis. GM604 appears to be safe, but if it turns out the drug is not, the long-term effects on mortality can't be much worse than the current prognosis of those who would be taking it. But if the efficacy lives up to the phase 2A trial results, PAVs have potentially a lifetime to gain. I make this appeal to you primarily for others. I am single with no dependents. Based on the commendations I receive about my attitude, I seem to be adapting better to my condition than most with it. I still joke that because I am almost as smart as Stephen Hawking, I will perhaps come close to living the 50 years he has with ALS. But many pals have children who need parents. Many pals are not fortunate to have the medical coverage I have available or the resources to acquire durable medical equipment. These would be people with active and alert minds trapped in a body that can no longer respond, no longer allow those minds to express. I expect the experience of other parents and their families will be much more traumatic than my own. As a community, we cannot wait. We simply do not have the time. I support the campaign and the petitions being run on change.org urging the FDA to enter GM604 into the accelerated approval program. I asked the members of the Senate Health Committee to contact the FDA to indicate support of GM604 or at least support its full and fair consideration. I asked the directors of the FDA to approve GM604 now. Thank you for your time.
Even when all that I could feel was fear, at least I wasn't